Hey everyone, this is Victor from Cyborg for Life, and in today's special interview, I'm joined by Dr. Dror Paley from the Paley Orthopedic and Spine Institute in West Palm Beach, Florida. Now, today we're going to talk about the recent recall by NuVasive Specialized Orthopedics of the PRECICE-STRYDE intramedullary lengthening nail. Now, this is a really interesting discussion because Dr. Paley was actually on the STRYDE nail development team, and so he's going to give his unique perspective of what he thinks the possible reasons for the recall could be. And so, without further ado, please enjoy the interview with Dr. Paley. Hey everyone, this is Victor from Cyborg for Life, and today I am joined by the king of limb lengthening, Dr. Dror Paley of the Paley Orthopedic and Spine Institute at St. Mary's Medical Center in West Palm Beach, Florida. Hey, Dr. Paley, how are you doing today?
Hey, Victor, doing great.
Awesome. It's great to have you back on the show. Now, Dr. Paley, I'm going to get right into it. There's been a whole lot of discussion going on online about the recent field safety notice released by NuVasive regarding the recall of the PRECICE-STRYDE intramedullary lengthening nail. And so I just want to get your thoughts on the topic about what you think the potential causes of the defect of the nail could be.
Yeah, so, as many of you heard, there's been a recall on the STRYDE lengthening nail and the Precice lengthening plate, and also the bone transport nail. These are the three products that have been currently recalled. The Precice nail itself has not been recalled. And so, first of all, I want to reassure everyone that this recall is issued as a precaution. It was a voluntary recall by NuVasive, the company that makes this. It was not actually something that they were forced to do. They did it on a voluntary basis. The titanium Precice lengthening nails are not included in the recall in the United States and are available for use. The stainless steel STRYDE nail is what caused the recall. Okay. And the STRYDE nail, as everyone knows, is a stainless steel, so it's a much stronger device. It doesn't, the titanium can only bear a certain amount of load, while the STRYDE nail was designed to be a full weight bearing device. And what happened here is that in the United Kingdom, a surgeon there noticed, he had a patient that had complained of pain after having a STRYDE lengthening. And he noticed that there was some reaction of the bone at what we call the junction site. And I'll show you some slides in a minute to explain that. And the reaction of the bone at the junction site, he assumed was related to the pain. When he took the nail out, there was some corrosion at that junction site. Corrosion meaning, stainless steel, when it corrodes, looks like rusted iron, right? Stainless steel is, I think what makes it stainless is the nickel alloy. And normally we don't, stainless steel doesn't rust, but if you have had stainless steel knives and forks, occasionally you'll see sometimes some rust on them.
Right. Yeah.
So it's not perfect. And in orthopedics, we've been using stainless steel implants. And there's various types of stainless steel. There's a bunch of different alloys. The most common is 316 stainless steel. Biodur, which is what this is made of, is another type of stainless steel. And they're all, they're all FDA approved. Many implants are made from them. Okay. So the two most common metals that are used for implants are stainless steel and titanium. Wow. And the third one is actually is cobalt chrome. Okay. And a lot of joint replacements are made of cobalt chrome. That's even stronger and harder. Okay. Now, stainless steel implants have been around. Steel implants have been around for 100 years. Wow. More than 100 years. Okay. Okay. So people have been implanting metal in the body, okay, in orthopedics for over 100 years, okay, maybe 120 years.
Oh my gosh.
So, so this is nothing new that we implant. And you can imagine the devices in the old days used to corrode a lot more.
Right.
But even with modern 316 or Biodur, which are the two stainless steels that most commonly used, you will sometimes take out an implant and it's got a little corrosion on it. There has never, ever been a single report of cancer, a neoplasm, from this corrosion. Okay. So corrosion in the body often doesn't cause much problem. It may cause, I guess, some inflammatory response, but not necessarily. Okay. So everyone's freaking out over this, but I want to reassure everyone that corrosion from stainless steel is not new. This is not the first implant, and it may be one of the first that's been recalled. Okay. But many implants have had some corrosion on them. There's another nail on the market, the FitBone. FitBone's made of stainless steel. I think it's 316 stainless steel. Again, different alloy. We've known the FitBone has corrosion, and I've seen pictures of it, and I've seen occasional reaction from it for years. I don't think it's really caused any serious harm to a patient. The odd patient may get a little symptomatic from it. Because these implants are being implanted for short periods of time, like a year, maybe 2 years sometimes, it's a very self-limited problem. And it would be totally different if the implant was a hip replacement, where you put it in and you got these corrosion things. You're not going to take the hip replacement out. Okay, that's meant to be a permanent implant. These implants, we have never ever said that you should not get them out. Even the titanium Precice nail that has no corrosion issues is recommended for removal. So we've always recommended removal when usually we say around a year. Why a year? Because you got to wait till the bone is healed enough and it has, is strengthened enough so that when you take out the device, you don't break your femur or tibia, right? You don't want that happening. So if you take it out too early, the bone is not remodeled enough and it can break. People are asking me, well, they're freaking out. I want my device out. Well, I can't take it out because you're only 6 months or 9 months or whatever. Now, some people heal really fast, and I'm okay. We just took one out on someone 9 months later. Okay. Instead of a year, because he was a really fast bone healer. So anyway, when this thing happened in the UK, this surgeon reported it to their version of the FDA. And, as a consequence of that, NuVasive had to report to their version of the FDA, and they temporarily pulled the Stryde nail. And then shortly after that, the Precice nail off the market. In the UK, they insisted on both. I'm not sure why. The Precice nail's been on the market since 2011. There's no corrosion issues. There were some breakage issue of the P1, but the P1 is off the market and never got pulled off the market because of breakage. The P2 had some issues, and P2.1 had some issues, and the device that's out there is a P2.2, and I helped develop that. It is a really great nail. We've put in, I've put in about 1,500 Precice nails, and I think at least 1,000 of those are P2.2s. And I think I have in 1,000 nails 1 breakage.
Oh my gosh.
So it's pretty uncommon. It is a really great device, but it has weight-bearing restrictions. We'll come back to that in a bit. So fortunately, in the United States, some logic prevailed. And they didn't overreact, and they pulled only the Stryde nail, and also any other implant for lengthening that was made of the Biodur stainless steel. So that included the Precice Plate, which is a new device for little children, and the bone transport nail, which is a special device for when you have a bone defect, like from trauma or a tumor, it grows back the bone. It's made of Biodur because they need to be stronger than the titanium, and they are innocent bystanders. There's been no reports of any issues with those. There's no corrosion, nothing has been shown on those. And so they've been pulled off the market, which is really annoying to us clinicians, because we have a lot of patients who are waiting for treatment with these really highly advanced technological devices that are really fantastic. Now, I want to take a step backwards and talk about the Stryde nail.
Yeah.
So the Stryde nail has been pulled, but let's remember, why did we invent the Stryde nail? And I invented the Stryde nail with the NuVasive company. I actually invented it specifically for stature lengthening.
Okay.
Why? Because, you know, we wanted patients to be able to walk around full weight bearing during their lengthening,
right,
during the distraction phase. And you know what? It has functioned absolutely incredible. I implanted the first Stryde nail in May 2018.
Okay.
Since May 2018, I've implanted about 400 nails.
Wow.
Okay. And so in 2 years, less than 2 years, really a year and a half, right? I've had one nail mechanism that stopped to work in the middle.
Okay.
Like it wasn't, we started lengthening, it was lengthening and it stopped working. And then I think I've had one more. No, so I've had 2 total in 400. That is 0.5%. That's a pretty reliable device.
Yeah.
Okay. I've had 0 breakages, 0 breakages.
That's crazy.
Okay. I've had all patients be able to achieve the length that they wanted, you know, within the tolerance of their bone and soft tissues.
Right.
You know, even the 2 that the mechanism failed, we replaced the rod and continued lengthening.
Okay.
All patients have achieved full weight bearing.
Wow.
You know, and so it did everything it's supposed to do.
Right.
Okay. So it did a couple things with this corrosion that it wasn't supposed to do. And that's what I want to talk about and show you guys, you know, a little bit about it. So I'm going to share my screen and show you what this is doing. Well, actually, you know, before that, let me, so we've done a study on this. So this is, I want to credit my co-authors on this, Dr. Aaron Huser, who's one of the other surgeons at the Paley Institute, and Dr. Craig Robbins. And actually, because I am a consultant for NuVasive company, I purposely did not, I basically recused myself from doing the actual review of the cases so that no one could state there was any bias in looking at this. So neither of these guys are, you know, consultants of the company, and nor did they develop the nail. So it's as unbiased a review. Now, what did they look at? So we pulled from May 2018 to June 2020, there were 252 Stryde nails implanted at the Paley Institute. Okay. So that was till last year, you know, so that's why it's 252. Wow. Since then, we've done, you know, I said up to 400. All the x-rays were reviewed, and we looked for changes in the bone, both at the nail junction site, that's where the male-female part of the nail come together, and at the locking screws at the lower end. So 130 cases were removed from the analysis because we only had 6 months of x-rays. Some patients, we never had their 1-year x-ray. We wanted to have minimum 1-year x-rays. And we of the cases that were excluded, of those 130, so they were only followed for 6 months, there were only a very small number of these x-ray changes.
Dr. Paley, are you sharing your screen? I don't see your screen on here.
No, I'm not sharing my screen.
Oh, okay. Gotcha.
I will share my screen.
Okay, just making sure.
So, and then we looked at 122 bones with Stryde nails that had a year or more of follow-up. Okay. And of those 122, 78 which is 64%,
Right.
had some changes in the bone. And I'm going to show you what those look like.
Okay.
Okay. And 44 or 36% had absolutely no changes.
Wow.
Okay. 40% had extra bone thickening.
Okay.
All right. 2% had a little bit of bone removal. That's called lysis. All right. And 21% had a combination of lysis and extra bone being made. Extra bone is called hypertrophic, that the bone becomes hypertrophic. Okay. And the almost no patients had any of these changes at 6 months. Almost all the changes developed somewhere between 6 and 12 months.
Okay.
All right. And so that's what seems to be the reaction to this corrosion. And I'm gonna show you one chart. So I'm going to share my screen now.
Okay.
And you have to, I'm disabled from sharing.
Oh, let me let me get in here and share. There we go. And cool. Okay, you should be able to now, I think. Is it any, let's see.
Yep.
Okay.
So this is a pie chart.
Yep.
Basically showing, so you can see here, and I will actually enlarge this so that this can be seen better there.
Okay.
Can you see it? Okay.
Yeah, perfectly.
So these are radiographic, meaning X-ray changes at greater than 6 months follow-up.
Okay.
So 36%, the blue section, had no findings. Okay, so a little more than 1/3 did not react to the nail.
Okay.
Okay.
Yeah.
So basically, about 2/3 did have a reaction. 40% of patients had this thickening of the bone, which makes the bone stronger, not weaker.
Okay.
We all want stronger bones, so this is not a bad thing.
Right.
And this is normal bone; it's not abnormal bone. And then 3% had this lysis, which is where the bone kind of dissolves away in some areas.
Okay.
Not enough to weaken the bone.
Right.
Been no fractures. And 21% had a combination of hypertrophic and lytic changes or lysis. Okay?
Yep.
So keep that in mind. I'm going to stop sharing. And now I'm going to show you what these look like on the x-rays.
All right.
All right. So we're going to share again. And let me pull up my PowerPoint. And I'm going to play this.
All right.
And tell me if you can see everything.
Yep.
Is that okay?
Yep, it's a perfect open screen.
So this was a study that we did in order to look at our own cases and see what's going on.
Right.
So this, I think, is a video. So this shows you the corrosion. Can you see my mouse?
Yep, I can see it.
Okay. So this is what's called the junction site of the nail.
Okay.
The male and female portion, and that's where the lengthening is happening. So, you know, probably originally, this was all inside the nail.
Okay.
Right. And then it's gotten to this point. Now, remember that during the lengthening, no one point stays over here for very long because you're lengthening at, let's say, 1 millimeter a day. So whatever was there is moving down. And that's why you really don't get any corrosion here. And that's why you don't get this corrosion for 6 months because this nail is moving.
Okay.
Well, I think what happens is when the nail stays in one place at the final resting place, there's a little bit of motion.
Right.
You know, just, you see there's a little space between the male and female end.
Yeah.
So they can slide. That little, see the black line there, the little gap, that's normal.
Okay.
But, and the slot here is, by the way, to control rotation. So nail can't rotate. So this point probably has a little bit of bending. You know, and that breaks down the alloy of the nickel and iron together, which make the steel stainless.
I see.
That exposes some of these iron atoms, which then oxidize because they're in the body.
Yep.
And in the body, you got oxygen, so it oxidizes, right? It's rust. This is rust, okay? This is iron oxide.
Okay.
That's what this is.
Right.
All right. And interestingly, you also see it a little bit around the screw hole here. Now, why? Because the screw, this is where there's a lot of load.
Right.
And you've got, again, a little bit of bending of stainless steel against stainless steel.
I see.
Okay. Yeah. And so you're getting that. So in other words, I think if this rod didn't have moving parts, you probably would never see any of this.
Okay.
Where do we see this in other implants? So we use stainless steel plates and screws all the time. Where the screws go in and hit the plate, they do the same thing.
Really? Wow.
And they notch that stainless steel a little bit due to pressure or the way you screwed it in. And when you come back to take them out, sometimes you see exactly the same thing. This is nothing new. It's nothing new. And those implants sometimes are in for years and there's no recalls. People are freaking out, and I do not appreciate those out there who've said, oh, there's a risk of cancer. This is BS. Nobody has said that. There's no proof for that.
Right.
Corrosion on stainless steel implants has existed at least for 50 years.
Wow. Without
a single report of a neoplasm, which is a cancer. Okay. So look, this is what it looks like. I'm gonna rotate the nail for you so you can see it.
Okay.
And there you see. Now you see this little thing here.
Yeah.
That's called the crown.
Okay.
So it's supposed to be there. It's not supposed to stick out.
Okay.
The crown actually is very important in making sure you don't get any rotational instability. Almost all the corrosion cases I've seen, the crown is moved like a fraction of a millimeter. And I think it has something to do, that motion is causing that crown to back out.
Right.
Okay. And it may have something to do with it. Not positive. Now, what are we seeing? So look, I'll show you several cases of different, this is example number one. Here is a hypertrophy. So this is the lengthening zone.
Yeah.
Right? You see my mouse, right?
Yeah, I can see your mouse.
So this is the lengthening zone. And this is the junction site. So it's normal to have the bone hypertrophic at the lengthening zone. This is during the lengthening, right?
Yep.
And it's normal to have that hypertrophic bone. Notice the junction site looks normal here, right?
Yeah.
The screw site looks normal. Now, even with the STRYDE nail, the Precice nail, we frequently see thickening at the screw site. Why? Because it's bearing load.
Okay.
Bone reacts to that. In fact, some people get so much bone, it covers the nail, which makes our life miserable to get the screws out.
Yeah, I have that.
Heterotopic ossification. And it's why I tell people, please don't wait more than a year, because we honestly should charge people more if they wait longer, because it takes me twice as long to get a nail out that's been in 2-3 years.
Oh, wow.
Okay, because I have to make a bigger, and you get a bigger incision.
Oh, okay.
So, so because of that, just come at the end of a year, as long as the bone's healed. So this bone is beautifully healed. I mean, this rod is ready for removal.
Okay.
Okay. And by the way, the date, so here's 8/13/2018, 10/17/2018, okay, at the end of lengthening, 5/31/2019. Okay. So I guess not quite a year.
Right.
Now look at the junction site. That's a hypertrophic or thickened junction site.
Right.
So the guy ends up with a stronger bone.
Yep.
That's the net consequence. Your bone is stronger. Okay. And that's probably, and there's no, very few patients have symptoms. The odd patient complains of some pain.
Okay.
at the junction site. Most don't. A lot of people do complain of pain at the end of the nail where the screws are, and that's called stress riser pain, RISER,
Okay.
because at the end, the bone has flexibility, but bone with metal is very rigid.
Okay.
So at that junction site, there's a change in the stiffness of the bone.
Right.
The bone goes from being very rigid to being very flexible. And this thickening that you're seeing here is the body trying to change that sudden change in stiffness.
Okay.
By thickening up the bone here, so it's making this part of the bone stiffer. It's a natural reaction.
Okay.
And all this goes away. The hypertrophic bone here, the hypertrophic bone here, and the hypertrophic bone here. If you remove the nail, 2-3 years later, you took an X-ray, the femur would look kind of like this femur.
Oh, wow. Remodeled.
The body has what's called the natural ability to remodel. And it's called Wolff's Law, where basically the body doesn't like to keep more bone than you need. That's why if you go up into space and it doesn't feel gravity, they lose a lot of bone mass.
Right.
Okay? You get osteoporosis. Okay. And the converse is also true. So if you load it a lot, you get a lot of bone thickening. Heavier people have thicker bones. Lighter people have thinner bones because the bone is an intelligent tissue. Okay.
Yeah.
Here's another case. Okay. So this patient, okay, has, as you can see here, a large hypertrophy at the junction site, right there.
Yep.
I'm sorry, right there. Well, here, it wasn't a very big lengthening. This was a unilateral. It wasn't a big lengthening. And interestingly, this patient got a lot of hypertrophy. It's hard to say if it's just from the screws or is it the junction site? They're so close together.
Right.
You know, because they never separated apart because it's this small lengthening. This is what it looks like after removal. Of course, you have the holes from the screws. That's normal, and they'll go away. They'll fill in. And in fact, the thickening here, make sure you don't break through the holes. So it's actually a good thing to have that thickening.
That's interesting.
Okay? At the screw site.
Wow.
All right.
That's cool.
Another example. So this is one case. This is a unilateral. It's the one of only 2 symptomatic patients I've had.
Okay.
And this patient developed a hole in the bone. You see that? That's called lysis.
Okay.
You see that hole?
Yeah.
And you can see the inner edge of the bone and then like a little divot.
Yeah, a little divot there.
That's lysis. That's what we mean by lysis. That lysis is not enough to cause a fracture, but this patient, and the lysis was here, not at the screw holes, here. You see a little bit of the black there?
Yeah.
That's the lysis occurring, and it's right next to where the corrosion was. Okay? And this patient, in fact, the nail came out, showed some corrosion. Okay? And with a CAT scan, it actually made a hole in the bone, and there was a little reaction on the outside of the bone where the bone made extra bone. So it was both hypertrophic and lytic. And probably some of these particles exited through the bone to the outside.
I see.
And caused a stimulation of new bone formation.
Okay.
So not a terrible thing, but, you know, full disclosure, what's going on. Now, let's look at this one. It's another tibia. And you can see a lot of extra bone around the screw holes. That's normal. That's nothing to do with the recall. That is totally normal. That happens in titanium nails, stainless steel nails. This is what makes our life miserable, to take these out, because it's like an archaeologic expedition. You have to excavate the screw out through the, you know, imagine taking this out. It's not a big deal. I can take these 2 screws out through a single 1/4-inch incision. This, I have to make a big incision, chop off the extra bone here. And, you know, but look why. This is 2018. This is 2021. The nail's still there.
3 years almost.
Okay? So if this patient had come back earlier, okay, I can't chase patients to have their rods out. they're clearly not having any pain, and that's why they leave it. But then this becomes way harder to remove. Now, if you look at the junction site, it did make a little bit of hypertrophic bone and a little bit of lysis there too.
Yeah.
So he's got a combination.
Okay.
Now, no one's complaining of the hypertrophic bone at the lengthening site. I mean, this guy's got huge amount of hypertrophic bone. That's good. It makes it strong. He's got a lot of hypertrophic bone at the screw site. Again, that's normal. But he's got at the junctional site, which is an area that normally did not get hypertrophy.
Okay.
So this is what's happening. And we are assuming this is due to corrosion.
The corrosion.
Because we find corrosion on the nail, and it's where this is. So, you know, haven't proven it's due to corrosion, but it is highly associated.
I see.
So it probably is.
Wow.
Okay. Another example. Okay, this one has lysis. You see the hole in the bone?
Yep.
Literally the lysis. So whatever that, what do you call it? The corrosion stimulated the bone here. It stimulated a little bit of hypertrophy, so it makes the bone strong. At the same time, it drilled a hole right through the bone.
Wow.
It caused some cells. There are two kinds of cells in the bone. There are these cells that make new bone called osteoblasts.
Right.
Okay, so they make a lot of bone. And then there are these cells that eat up bone. I call them Pac-Man cells. They go around eating, you know, and they're called osteoclasts. So clearly it caused an osteoclastic reaction, but it also causes an osteoblastic reaction. So I can't tell you we understand the biology here.
Right.
By the way, when the rod gets removed, you can see the hole.
Yeah. Yeah.
Now, is this a risk for a fracture? Yeah, it is. So are these holes. But because of the hypertrophy, you've got actually more strength added than strength removed.
Okay.
I think I showed you only 2% of cases had pure lysis.
Right.
Almost all the other lysis cases had hypertrophy.
And
so again, all right, not a big deal. And we're calling it junctional lysis. All right. And junctional hypertrophy.
Right.
Example 6, this is a tibia. So this is full thickness lysis at the junction. All right. This is after removal. And you can see a big hole right there.
Yeah.
Now, by the way, there's lysis in the area where the bone was lengthened. No one's worried about that. That's a natural process. This is not a natural thing to have happen. And you can see this ate the inside of the bone here. It made a little bit, you see this little thin, it created a little hypertrophy, but it created a lot more lysis. The tibia, because it's got another bone next to it protecting it, it's safe. It's not going to break. Okay. So nothing happened to this patient, and nor did they know they had any issue. Rod, the problem is gone. Here's another case. This one's interesting. This is junctional lysis, you see here, and then it made a hole, and you can see the new bone that it's forming on the outside. This is early in the process. You can see this new bone. Okay. And it's at this level here. All right. Example 8, you can see, again, some lysis and some new bone formation on the outside of the bone. Probably there's a little hole. For the bone to form like that, there may be little holes where the corrosion is stimulating cells out there. Okay. Interesting. So this is just showing it's a hypertrophic case. And so my staff has really documented. Look at this one. This one's impressive.
Oh, that's a lot of hypertrophy.
Look at the amount of hypertrophy.
A lot, yeah.
This patient has no symptoms.
Right.
By the way, this is a good bone former because this patient also made a ton of bone in the nail. And I think they left the nail in a long time.
Okay.
It was a 4-segment lengthening. Interestingly, a little bit of lysis here, but no hypertrophy in the tibia. Okay. But a lot of hypertrophy in the femur.
Yeah.
And it goes on. I mean, I think
that's
point.
incredible. Wow.
So,
so the majority of the cases are creating hypertrophy, and that hypertrophy is kind of like extra reinforcement for bone stability, essentially, right?
Right. So hypertrophy itself is not a negative thing.
Right.
You know, the what do you call it? The lysis. So you don't want lysis,
right?
Because that could weaken the bone.
Okay.
But having said that, we haven't had. So the only risk of the lysis is fracture.
Right.
So we've not had a single fracture.
Oh wow.
So the lysis has never been bad enough that it weakened the bone enough that the bone broke.
Yeah.
So we're more worried about lysis. I'm because almost every lysis case has hypertrophy. It's almost like it's protecting itself at the same time as it's weakening itself. So it means it's, you know, that's why it's probably why they don't break, because they actually are probably still stronger even with the lysis.
Right, because the hypertrophy is there. That's so cool. I did not think that the hypertrophy was happening in these patients. So that definitely is going to help, you know, ease a lot of patients' worries about what's this new bone growth. It's actually not a bad thing. So
now, I will tell you that because the device is in for a limited period of time, a year.
Right.
First of all, I think anybody who is getting lax about having it removed, you know, hopefully this is a stimulus to come back and have your nail removed.
Right.
Okay. If it's a STRYDE nail. And look, there's other reasons that, you know, this has, so you know, the nail has a magnet inside. It's a rare earth magnet.
Yeah.
It is hermetically sealed.
Okay.
That means it's sealed from body fluids.
Okay.
We know, so that rare earth magnet, that is not an FDA approved metal to put into the body unless it's sealed.
Okay. Gotcha.
Okay. So it is approved by the FDA to put in, but in a hermetically sealed chamber.
Right.
But eventually every seal can break.
I see what you're saying.
So the longer you leave it, the greater that risk. We don't know what effect having those rare earth magnets in contact with your body fluids has.
Yeah.
Okay.
There hasn't been
Well, we know that stainless steel, even if it corrodes, being in the body just doesn't cause much problem. Okay. We don't know what happens. So the reason for years that we've been saying take out the nails is not because of the risk of corrosion,
right? Because
of the risk of, you know, a break in the hermetic seal, which we haven't seen that, but that's why I've encouraged people. So now people are freaking out over the corrosion. So fine, I understand that, but get your nails out.
Yeah,
you know, at a year. Don't wait 2 years or 3 years. Now, I do have some patients who are on what we call option 5, where we lengthen their femurs and tibias. There's the 4+4 method. Right. We lengthen the femur and tibia and then let the nails sleep, come back a year or 2 later and re-break the bone.
Yes.
Without changing the nails, and then start lengthening again. Okay. It's a very good option. It gives you more length, so you can end up to 16 centimeters of total length, which is 6 1/4 inches.
Jeez.
That does require leaving the nails in longer. And I just had one of my patients inquire, so should I get my nails out or can I have my second lengthening? I said, no, just have your second lengthening. So I'm not trying to be glib about this, but I am not very worried. Okay. if this was causing severe pain and disability, that's one thing.
Yeah.
It is causing a reaction. I think the nails need to come out, but I'm not freaked out about it.
Okay.
And I want to reassure patients that, you know, it's not a horrible thing. Now, what are we doing about it? So, first of all, I want to commend NuVasive. And the nails are made by NSO, which is NuVasive Specialized Orthopedics. And NuVasive is actually a spine surgery company.
Right.
Before they bought Ellipse, which made the Precice nail. And so they created a separate company called NSO, NuVasive Specialized Orthopedics, which houses, it's the one who develops the Precice nail, Stryde nail, Precice Plate, bone transport nail,
okay,
a couple other devices also. So I want to commend them. They have really jumped all over this immediately. They did not try to sugarcoat this. They did not try to downplay this. They immediately went to key opinion leaders like myself and a couple others in the country and said, do a study for us. Okay, independent study, including also in Europe. They've had a couple of these studies done in Europe. Basically, we're all finding the same thing. So it's well documented. They're doing metallurgic studies on the nails that have been removed. So all the nails are going back to them and they're studying them. They are trying to study how it's happening. So they're doing a bunch of biocompatibility testing on the nail. Okay, so additional tests. And again, they're doing all this voluntarily. This was not the FDA that came down and said, hey, we're recalling your product. This was a voluntary recall. And it was not a punishment by the FDA. Okay, no, it's very important to understand that because and they did not dilly-dally. I will tell you, as their consultant, I actually advised them and advised you know, their FDA consultants that I felt that they could do all of this while leaving the Stryde nail on the market and obtaining appropriate consent forms. They decided that the safest thing would be to pull it, and then to pull the Precice Plate and bone transport nail. I felt that, you know, that really penalized us and penalized patients, but they felt they did everything responsibly. I am glad that they were able to leave the Precice nail on the market. I want to remind everybody, we've been lengthening with the Precice nail since 2011. I implanted the first P1 Precice nail December 1st, 2011. Okay. I implanted the first Stryde nail May something, I don't remember when, 2018. Okay. So almost 8 years later, 7 years later. We did fine with the Precice nail. We put in quite a large number, so both for unilateral and for stature lengthening. People ask, well, and by the way, lots of patients did their stature lengthening with the Precice nail. Same strategies. Takes just as much time, same rate and rhythm of lengthening, right? Okay, that's not the same amount of time for bone healing. Okay, same amount of, you know, at our place, they have to stay for the lengthening, same period of time, not one day more or less. The only difference is the inconvenience factor of limiting the amount of weight bearing to somewhere between 50 to 75 pounds per leg, depending which diameter rod you got. We did this before, and although it was a challenge for patients, they accepted it. The moment you come out with a better device, no one wants to do the Precice nail, you know, because it's like this. This is the iPhone 12. The iPhone 12. And the iPhone 12 is better than
The iPhone 11.
1, 2, or
Oh, yeah.
whatever.
Or even 11, yeah.
But hold on. When I had the iPhone 6, I was pretty happy.
That's true.
I think I've had every model, not the half models, but every model from the iPhone 1. Okay.
Wow.
And every model, I was pretty happy. It was better than what I had before.
Right.
Now, if you ask me, would I go back now to my iPhone 6? I'd say, hell no. But if you took away my iPhone 12 and the only thing I could have is the iPhone 6 for the next 6 months, and you're going to give it back to me in 6 months, I say, okay, fine.
Okay.
You know, accept it begrudgingly. Okay. Because it still makes phone calls.
Right. Still text.
It still does almost everything the same. There's 1 or 2 functions that are better in the new ones. The camera's better, right?
Yeah, definitely.
Okay. So, but I took pictures before.
Yeah.
All right. So that's my message to everyone.
Okay.
If you really want to wait till Stryde comes back, I'll talk about that in a minute.
Yeah.
That's one option. But, you know, right now with the pandemic and COVID, a lot of people are working from home or not working at all or have more time available. And they're saying, oh, but now's like the most convenient time. I want to do it. So do it. Like, what is the consternation here? Do it. Your results will be identical. Your inconvenience factor will be greater. But on the other hand, your convenience factor, because right now is a better time for you, is better. So it's like this, right? I have to suffer with the iPhone 6 and but I have, I have more time now. And, so yeah, you can have it with the Precice nail.
Right.
5 months later, if you do an 8-centimeter femur lengthening, you're going to be off the crutches and so on. The price is a little lower.
Oh, that's true.
Again, I'm only speaking at our center. I don't know what other people do. Right. But we basically don't try to make money off the nail. So we pass on, it's called a pass-through. We pass on exactly the cost of the nail to our institution, to the consumer. Okay. So the Precice nail is cheaper. So we did not try to keep the prices the same.
Okay.
But by the same token, in May 2018, we raised the prices.
Right, because the Stryde is more expensive.
Okay, and so we just went back to what we did before, and we are, there was a little bit of a dip, and now I'm getting a lot of patients coming back and realizing that it's not such a big deal. They really want to do it now. And we're open for business. We're doing it. We're doing it as safely. You're not going to get a worse result. You're going to have the same recovery, same final result. And our therapists are used to working with the old restrictions and with the new ones. Okay. So
there's no, so they can get it done. Because I know a lot of people were asking me like Precice 2 versus Stryde now, and you just cleared that up for them, that they can get it done. It's just the weight bearing restrictions and whatnot. Dr. Paley.
Kind of, the last thing I want to kind of talk about is, so when's it coming back?
Yeah, that's exactly
what it is coming back.
Okay.
It is coming back.
Yeah.
But clearly, I think the company wants to achieve 2 things. One, it wants to understand this corrosion thing. Okay. And it wants to understand, by the way, the corrosion, just separate. So the corrosion thing seems to be load related.
Okay.
Bilateral cases get it much more frequently than unilateral.
Yeah, that makes sense.
So in the cases that didn't have the reaction, many more of them were unilateral. Why? Because when you have a good leg to support you, you're not loading the other leg as much.
Yeah.
When you have both legs involved, you have no choice, and you're full weight bearing.
Right.
So that's a very interesting thing, and it lends itself to the understanding that this is, probably the, loading.
Right.
that's causing it, right? When you're 8 centimeters lengthened, there's a lot of load on that thing until the bone is healed, okay? Second thing, so we've learned that. So the company wants to make sure they understand what's going on, okay?
Right.
And they're doing all this testing, you know, want to make sure that this is ferrous oxide or whatever this is, you know, they want to look at all kinds of parameters. Number one. Number two, and this is also for safety reasons. Number two, they're looking at how to either prevent or contain the problem.
Okay.
And there are many solutions. I mean, and they're logical solutions.
Right.
You know, one is to prevent it. Could you coat the metal?
Ah, yes.
So that it doesn't happen.
Right.
For example, you know, there are a lot of implants in orthopedics with polyethylene. A hip replacement is metal and plastic. The metal ball and the plastic socket.
Right. Yeah.
So could you coat it with a polyethylene? So now you have something between the two layers of metal.
I see.
Like, could the crown be made of polyethylene or coated or whatever?
Right.
So we're looking at that.
Okay.
Looking at options so that even if it occurs, it can't escape a internal covering. So it's no longer exposed to the body, hermetically sealed.
Right.
Okay. So if can you hermetically seal the junction site?
Oh, that would be interesting.
So these are just two options that are being entertained. And the Stryde's not going to show up until the company has fully analyzed on all their biocompatibility tests and figures out, you know, a way. Well, if they come to the conclusion that this is not a big deal and it's acceptable, and the FDA were willing to accept that, they may not look to do a fix. But if they come to the decision that no, this is not acceptable,
right,
and we need a fix, I think that's more likely. Then it's going to take longer.
Okay.
Because we got getting a fix, making that fix approved by the FDA takes time.
I see.
So no one knows how long this will take.
Yeah.
I've been assured that it won't be before August.
Okay.
That this is coming back. My personal guess is going to be longer.
Okay.
Okay. I think every time you think you're going to have it done, it's always going to take longer.
Yeah.
So I've written off the Stryde nail for 2021.
Oh, wow. Okay.
And I think, look, I don't like to, I'd rather under promise, over deliver.
Right.
And by the way, when the Stryde nail was coming out, and I was going to be the only surgeon to have it because I invented it, I think I had it for at least 6 months before everyone else.
Oh, wow.
Okay. But I was promised the Stryde nail way earlier in the year. And I think actually even the year before. And it kept getting put off and put off and put off and put off. Look, what I've learned from that and from other things is there are a lot of due diligence to do to get through the FDA and to get a product to market, even the manufacturing side of things. Even once you're approved, you got to, you know, you have to have a supply, you have to have a supplier, you have to do quality assurance and testing and so on, you know, even once you're fully approved. So I think that optimistically, September is the earliest it would happen.
Okay.
Realistically, I'm looking at January
2022.
And it could take longer.
Wow.
You know what? If they're going to do this, they're going to do it right. Very responsible company, very responsive company, and they're going to do it right. And they are going to, the new and improved Stryde nail will re-emerge. But in the meanwhile, let's not forget there have been a lot more precise nails put in.
Yeah, I have one.
There's a lot more proof of safety with the precise nail for many more years.
Right.
And if somebody wants to have a lengthening, is willing to put up with the inconvenience of which we put up with for years of partial weight bearing,
Right.
then then there's no reason you shouldn't have this done by the same surgery, the same everything, same physical therapy as before.
Okay. Do you think that they would release the Precice Plate or the transport nail before the Stryde nail, or?
I think they will, because those don't need a fix.
Oh, okay.
There's not been a single example of corrosion with those implants. The other thing is that the Precice Plate is only left in a few months. We're not seeing this problem prior to 6 months.
Oh, wow.
All our Precice Plates are removed in about 6 months.
Oh, okay.
It only lengthens 4.5 centimeters, so that's much quicker lengthening.
Right.
It's about 9 weeks, and it's in little kids, and the bones heal much faster.
Yeah.
So it doesn't stay in very long.
Okay.
And it has a much smaller piston that comes out. So there's not as much surface area to corrode or have this problem.
I see. Wow, man, that clears up a lot of the confusion that's been going on in the limb lengthening community lately. Wow, Dr. Paley. So yeah, I just want to kind of end on a note that you have a massive fan base. If there's anything you want to say to them, obviously you kind of said that if you want to get your lengthening done, guys, you can still get it done with the Precice too. But this is your chance to kind of shout out to your prospective patients and fans out there.
Well, look, we still run the biggest, most experienced, safest limb lengthening program in the world. Okay, I've been doing it longer than anyone else. For the first cosmetic stature lengthening, 1988. The first dwarf stature lengthening, 1987. Okay, I don't do this alone. I do it with Dr. Craig Robbins, and then we have another partner, Dr. Claire Shannon. She's not as involved in the stature, but occasionally she's always there. So we are really well equipped to look after these patients, and you're getting, the top of the top, the most experienced, and look, the people want to come to us. We have a very strict protocol-driven program. I tell everybody, we don't compromise. You have to stay for your lengthening. Right. If that's not what you want to do, then go somewhere else. But there's a reason we do that. Right. And our patients return to normal function. Okay. So look, we welcome anybody who's interested in this. We do Zoom consultations now. Okay. So you don't have to come in person. So we will do a Zoom consultation online and go over everything. Really, actually, for this, the Zoom consultation is almost as good as an in-person consultation.
Right. Yeah. For stature lengthening. Very.
Yeah. We're easy to find.
Yeah. I'll be sure to post all your links in the show notes. So awesome. Well, everyone, that is Dr. Dror Paley of the Paley Institute in West Palm Beach, Florida. Like I said, if you're interested in reaching out to him, you can see all his contact information below. Dr. Paley, it's an honor as always.
Pleasure, Victor. And I really hope, I'm getting lots of emails and I answer every one of them myself. We did put up a notice on our Facebook page about the recall to explain it, but I've also personally answered each person who's written to me out of concern. I totally understand. I am not, by the way, I'm not downplaying this out of any lack of concern for patients. Right. I truly believe that, and I hope I never have to eat my words, but I truly believe, based on everything we've done from our own studies, everything I've studied in the literature, that while we don't want to have this corrosion or this reaction, I don't think that it's causing any long-term concern for patients, nor that in my patient group that has caused any real harm to any patients, except making their bones stronger.
I love it. Awesome way to end it. All right, Dr. Paley, thanks so much. Hopefully have you on again sometime.
All right, Victor, take care. Have a great weekend.
Awesome. Bye-bye. Wow, what an amazing and informative interview and presentation by Dr. Paley on what he thinks the possible reasons for the recall could be. Now, he did mention that the Stryde nail, he doesn't know exactly when it's going to come back to the market. And so for those of you who are looking to get lengthening done in the meanwhile, he said that the Precice 2 is a fine choice and has an amazing track record of success. And so if you're interested in reaching out to Dr. Paley and his team for consultation, you can find all of his contact information in the show notes. Until next time, this is Victor from Cyborg for Life, signing out.